So hey guys, I'm Joseph Wise, and today I'm gonna tell you guys about the time that when I broke my best friend's fibula. So, so it was a warm day in May. Me and him had just gotten down to my grandparents' house. We're down in Charlotte, North Carolina, because he decided to come down for about a week or two to go to the Post Malone concert. And on this particular day, it was hot outside and we were bored and we had nothing to do, so we all decided to play some football. It was me, him, my brother, and our other friend, and we all decided to play tackle football. So he'd already scored twice. I think he was up probably about a touchdown or two above us, and I was tired of him scoring. So I finally decided that I had to stop him and I had to do something about it. So for the play, I took the ball, he snapped it to himself, and he started running with it. And that's when I came up behind him and I went to go tackle him. And then as soon as I tackled him and landed on him, is when we heard the first initial loud snap. So when the snap first happened, I kind of freaked out and panicked. I noticed that his leg was off and it wasn't right and something was out of place. So the first thing I thought was to pop his leg back into place, which actually later on, the doctor told us that that was a good thing, and that if I didn't do it, then they would have had to have done it, and it would have hurt like a lot worse for him. So that's pretty good. But other than that, there was really nothing we could have done for first aid. The only thing we could do was we called my mom and I carried him inside. We bandaged him up a little bit, and then we drove him to the hospital so he get the proper care that he deserved. And yeah, like I said, there was no one there who could help with the injury because no one knew what to do. Nobody was trained. It was just me and my grandparents and my little brother. So no one knew how to do, so we had to bring him to the hospital as quickly as we could so he could get proper care. And when he got there, I felt like the care was appropriate. They were able to get fluids into him. They got him all x-rayed. They got him all bandaged up and got a good cast on him. And then they were able to inform him on what steps to take next. I don't think I would change any way he was cared for. Like I said, they all seemed to know what they were doing. They all did it properly. The only thing I might have changed was probably the medication, because I feel like the medication they gave him wasn't strong enough and he was still always in pain. So injury now is doing a lot better. He can walk, of course, now. The only problem he has is he has mobility problems in his ankle. So it's hard for him to get that full range of motion because of that plate they had to put in there. And or sometimes it hurts from when he runs or sprints or when he's out in the cold. And yeah. So other than that, I'd say the injury is doing good. All he needs to do is maybe get some screws taken out later in life. But other than that, and probably working his flexibility in his ankle. But other than that, he should be good. So for the anatomy part, alright, well first off, here's here in the hospital. He's just chilling there. For the actual anatomy, here's an x-ray of what happened. So as you can see in this x-ray, here's a basic anatomy of it. When I fell on him, I ended up causing the distal end of his fibula to snap completely in half, so right here. I also caused a significant amount of blood vessels to burst, as well as I caused his anterior and posterior tibial fibular ligament, his superior fibular retinaculum, and his posterior talofibular ligament all to tear. So so these ligaments are typically responsible for keeping his foot upright, and it's what helps him to be able to perform dorsiflexion, plantar flexion, along his pronation and supination. So obviously, because his ligaments were torn, he wasn't able to walk. He wasn't able to run. He wasn't able to jump. He wasn't even able to move his foot. So that's basic anatomy of it, and what all those parts I injured does for him. And an injury like this typically happens, so they're common, and it typically happens when an individual experiences some kind of trauma or force against the lower leg or ankle with enough force that their bone can't handle, and it ultimately causes or that bone to snap, and along with the ligaments to also tear. The signs and symptoms for a broken fibula include things such as pain or swelling in the lower leg, deformity of the leg, the inability to stand or walk, limited range of motion in the knee or ankle area, and if there is a significant amount of bruising or discoloration like around the ankle area. There's not much first aid you can do for this type of injury, besides maybe bandage it up right away. But other than that, it's important to get the individual to the hospital as quickly as possible so that they can get the proper care that they deserve. Surgery for this type of injury is typically required within the first few weeks. If surgery does not happen, then it could potentially cause a lifetime of problems, along with a severe leg deformity, because the bone could have grew back the wrong way and maybe they didn't come back together or anything like that. Typically what they do for the surgery is they cut them open, make sure all ligaments are back in place and where they need to be and ready to heal, and or usually they put a metal plate on his bone so that they're both in the right track and they're both able to grow back and fuse together where they're supposed to be. So the rehab for it can be long and grueling, but usually it's well worth it. Once enough of it is healed and it's okay to take off the cast, typically when rehab begins. For rehab, typically they focus on things like ankle rotation and ankle flexibility, and they can also even help you gain back the strength in your lower leg, as well as recover some muscle mass, as muscle atrophy is likely to have occurred in these couple of months. The goal is to make sure the ankle is strong and stable enough to allow you to perform the correct range of motion and do everyday tasks such as walking and running without pain. And so that's it for the broken fibula. And yeah, that's pretty much all there is to it. Thank you.